Welcome to the Rim Break Rodeo. We hope this video helps.
You begin with one clear action. Clean the area where the patch will sit. Use soap and water, then pat dry. Do not apply creams. Once done, tear open the foil packet carefully along the notch to avoid touching the adhesive. Make sure to check the patch for damage and the expiry printed on the pouch. If you have sensitive skin, test a small area first. These steps ensure proper adhesion and consistent vapor release for effective comfort. You peel the backing straight off and position the patch immediately. Avoid touching the sticky side so oils from your fingers don't reduce adhesion. Place it on your upper chest over clothing or directly on intact skin, centered and flat. Press down firmly for about 10 seconds to secure all edges. Make sure the patch lies smooth without wrinkles, and keep it away from eyes, mouth, and broken skin. Proper placement ensures steady vapor diffusion and maximum comfort. You wear the patch for the time recommended on the packet, then peel it off gently starting at a corner. Discard the used patch in household trash. Once removed, wash the area if any residue remains. If you notice irritation, redness, or breathing issues, remove the patch at once and rinse the skin. Seek medical advice if symptoms persist. If adhesion fails, make sure the skin was dry and oil-free. Replace with a fresh patch and avoid reusing the same spot too soon.
Thanks for watching. Consider subscribing if we helped you.